It isn't. So auditory processing, you have two different things, right? We have medical conditions and then we have educational eligibilities. Let's take, for instance, TBI, traumatic brain injury. Traumatic brain injury is a medical condition that happens to individuals at any point, right? However, as a federal eligibility, TBI is a traumatic brain injury that only occurs after the individual has been born. So for purposes of this, if you had a child that had cerebral palsy, often that traumatic brain injury occurs during the birth of the baby. So medically, that's a TBI. But special education, it is after the baby is born. So remember, the parameters are, this is an educational eligibility. This is an educational eligibility that rises to the level of specially designed instruction. So what would be the specially designed instruction if I had auditory processing disorder? So let's think about that. So auditory processing disorder it's when the student struggles to discriminate sounds, but it's neurological, right? So it's not physical as a traditional DHH, deaf and hard of hearing. And so often for those kiddos, when we get really good ENT evaluations, and I see a lot of them, I recommend my families do that a lot, especially when there is ADHD. It really, is, as much as it's neurological, you can make adjustments physically. Like there are kiddos that are way higher on one side than the other side, and that's going to help their acquisition of information. But it is not currently one of the 13 eligibilities.